pre-op appointment about 2 weeks out. Come sign some paperwork and I don't know what else. Blood work maybe. Ask a bunch of questions and see how they're gonna do this whole surgery. Hopefully, I don't have to wear a mask during the surgery. Done with my pre-op appointment. Kind of went over everything. I had originally the appointment was originally scheduled for today, May 5th, but due to the whole COVID thing, they had to reschedule a couple things. So, you know, the reason I'm getting this obviously is in 2015 October timeframe, I fractured my back. I didn't know it then. I was told it was a muscle sprain, like just take it easy, but I was doing some training and I couldn't stop, so I just kept going. December it was still hurting, so I went to a chiropractor, paid out of pocket. They did an x-ray and he asked me, he's like, you ever fractured your back before? Nope, not that I know of. I think I would know. And that's it. He did my adjustments. I felt a little bit of temporary relief for, I would say, a couple weeks. He did a couple adjustments and then just kept going on. I had some more training after that. I was pretty physically demanding, I guess, given the circumstances of my back. But the whole time I was in pain during those whole 6 months. So I just endured it, continued doing it, and all I could think about was just passing that course because I knew that it just kind of meant new opportunities for the family. So I endured, and it wasn't until about 2016 October when I got my actual MRI and another x-ray, and they confirmed it, saying, hey, you have, you know, L5S1 fractured pars defects, and they were completely fractured off, so it wasn't like a hairline fracture, it was fractured off. Again, at that point I had made a new career change, and having just started, I didn't want to really ruin my opportunity. So I went to physical therapy, said, what should I do? And they had me do the physical therapy portion. Then they referred me to pain management, in which I got steroid injections. And that actually helped. The first one helped for about 6 months. It felt great. I knew it was fractured, so I didn't overdo it. But once it started wearing off, then it reminded me of quick, yep, here comes the pain again. So I went back to pain management. I was like, same thing. And they're like, sure. The second time didn't really work too well. So I was like, okay. So then they started doing all these alternative type of pain management techniques. So I've done acupuncture, I did chiropractor, I did alpha stem. It's some, I don't know, it's like electrodes or something. And I also had the other one that had like electric impulses or something like that. So I feel I've done a lot of stuff. And you fast forward to this year, 2020, it was just getting so bad that I just, you know, I had to do something. Could I endure it? Sure, whatever, it's pain. At this point, it became normal. It became normal that I was in pain, until I started thinking, like, wait a minute, this is not normal. I should be able to go grocery shopping with the wife, or go outside for a walk with the kids, or play soccer, or anything with them, but I can't do those things, and it's not normal. So because of that, that's kind of what led my decision to wanting to get spinal fusion surgery. All those pictures, you can kind of see the progression. I think right off the bat, it was just bad in the beginning, but I just endured the pain, which I shouldn't have. But I was taking the recommendation from the physical therapist and the pain management, who stated avoid surgeries at all cost. And you keep hearing other people say, don't do it, but none of them have ever had it. So it was discouraging, and that's the reason why I stayed away from surgery as an option, because everyone was telling me, don't do it, you're young. I'm about to be 37. To some that's old, but to me it's young. So they said don't do it. But now, after I've talked to a few people that have had this surgery specifically, who state, you know, like, I feel significantly better. They may not be 100%, but if it's significantly reduced the pain, then I'm all about that. And if that means that I have to retire or get forced from my job right now because it's physically demanding, then that's okay. I think I'm ready to accept that. But at this point, I just want to be pain-free, or less pain, so I can enjoy just normal everyday activities such as walking, you know, riding bikes with my kids, or playing catch with them, and not be tired after 5 minutes from just standing up, because even just standing hurts, sleeping hurts, everything for the most part. Walking, it's pain. I just deal with it because it's normal to me, I guess. But good thing is, I guess it kind of increased my pain tolerance, because I just kind of ignore it now. But it does suck.
So this is the spine. This is S1.
Mm-hmm.
This is L5. This white is the disc in between. Your spine has fractures of these joints that are right here and right here, which allows this bone to slide forward. Meaning this one slides forward this way.
Right.
At each level where I'm putting my fingers, these are called foramen. And nerves come out of this foramen. In particular, your L5 nerve root comes out of this foramen. What passes right by is your S1, your S2, your S3, and S4. Okay, they control your bowel, your bladder. They control erections. They control the ability to control your sphincters, both peeing and stool. So there's a lot of high-end real estate, as you would call it, that passes by this level. But because this is slid forward, these nerve roots that are passing by are strangulated, which is S1. That's the nerve root that goes to your calf muscle, which is why you're getting the wasting of that muscle, because there's no neuron. The connection between the brain and your calf muscle, there's a disconnect, or the nerve there is being strangulated. And there's also the nerves that are coming out of this foramen can be under stenosis or pressure because this is collapsing, as you can see here. Now, with looking at your anatomy, there are major blood vessels that run along the surface of the spine, both arteries and veins. One is the aorta, which comes up here. It branches into your iliac arteries. Then it's your inferior vena cava, a large vein that branches into your iliac veins. One of the veins crosses just in front of the side of this disc space. And for me to do the surgery, I have a surgeon that's going to give me exposure coming to the front of your spine, and I'm working in a corridor just as wide as my fingers. I discussed it with the general surgeon, and he has had challenges in another patient with a vessel that looked very similar to yours. The only difference is he did not do that surgery with me, and I have, in terms of the spine surgeons here, the most experience doing this technique. This is what I train doing, and this is what I primarily do. So I asked him for his thoughts on the safety of doing this approach for you. And he felt as though, with the right equipment that I use, that we should have a better chance of doing this safely. Okay. I put the caveat that if I feel as though I don't feel comfortable watching him and assisting him, that I will abort and not put you at risk for injuring of this vein. Now, why is that important? Because if you injure this vein, I'm very confident we can stop the bleeding. That's not a problem. But if you damage a vein, what happens as the body's inflammatory response, it will develop blood clots in the vein, and they can travel, meaning veins flow up, so they can go to your heart and into your lungs and cause pulmonary embolisms, which in some cases can be fatal depending on the size of the blood clot.
And that's pretty much all I have. We'll try to keep you updated after the surgery, the day of, and everything, and honestly, I'd like to keep going and updating you all as the surgery, the recovery process. So hopefully, a week out, 2 weeks, a month, and then from there maybe possibly just monthly, and then hopefully a couple year follow-up depending on how everything goes. They did say, because it's been jacked up for so long, that the L4 also had a little bit of disc degeneration and disc loss, but it wasn't significant. So at this point, they're like, hey, we don't need to touch that, but the L5 S1 fusion should hopefully kind of remedy that, because now the strain should hopefully be taken off of L4 from what they're saying or something. But I know it's possible, so I'm not going to go back and try to get all in crazy, insane shape how I thought I used to be, but I'll just get in decent shape again, and not overdo it, because I know that it's not like I'm going to be 100%. So I'll do it to where I feel comfortable and to where I'm content with my fitness, but not, killing myself and causing further damage. That's it.